truth about fluoride beyond the propaganda. Two examples of propaganda that I'm referring to are, number one, water fluoridation is a safe, beneficial, or cost-effective public health measure for preventing dental decay. Number two, and water fluoridation is one of the 10 great public health achievements of the 20th century. I offer to you the following scientific facts that will begin to take you beyond the propaganda about fluoridated water that unfortunately many people have literally swallowed. First of all, fluoride is not a nutrient for our teeth. Human beings do not need fluoride to prevent tooth decay, nor do we develop tooth decay because we are deficient of fluoride. Fluoride actually acts as an anti-nutrient. It can interfere with the body's use of mineral iodine, which is necessary for thyroid health, and inhibit the action of a variety of enzymes in the body. It is a cumulative toxin. We only excrete about 50% of the fluoride we ingest every day. The rest accumulates in our teeth, bones, thyroid, brain, and other organs. Numerous studies have linked fluoride to a variety of health problems, from fatigue to infertility. Fluoride has been shown to rot teeth and bone, causing dental fluorosis, skeletal fluorosis, tooth decay, delayed tooth eruption, kidney disease, arthritis symptoms, brittle bones, hip fractures, and bone cancer. In fact, 41% of American children have dental fluorosis or damaged tooth enamel, which is the first visible sign of fluoride poisoning. It can also damage our brain. Over 20 human studies and over 100 animal studies link fluoride to brain damage. Not only can fluoride cause abnormal brain development, but a 2012 study established the role of fluoride in lowering the IQ. The thyroid gland is also particularly susceptible to the insidiously poisoning effects of fluoride. Fluoride reduces thyroid function and can cause hypothyroidism. In fact, between the 1920s and the 1950s, fluoride was used by doctors in Europe and South America to suppress function in patients with overactive thyroid. I think it is very valuable to be aware of this when considering the growing prevalence of thyroid gland dysfunction in the U.S. Fluoride is the only chemical added to tap water for the purpose of medication. Fluoride is a drug that's being prescribed to the entire U.S. population without consent in a country founded on individual rights and freedom to choose. Fluoride is a poison. In fact, on every tube of toothpaste, there is a warning label that states the following: if more than used for brushing is actually accidentally swallowed, get medical help or contact a poison control center right away. Fluoride has been rejected worldwide. 98% of Europe is fluoride-free, yet European dental health is generally considered equivalent to or better than in the USA. China does not allow water fluoridation because it's too toxic and causes damage. Instead, China sells their fluoride waste products from their phosphate fertilizer industry, classified as hazardous waste, to the US, where we add it to our water supply. When addressing the subject of water fluoridation using the word propaganda, it's certainly appropriate. Back in the 1950s, one of the men who was called upon to help convince people that drinking fluoridated water was good for their teeth was a man who had written a book called Propaganda, 1928. His name was Edward Bernays. Edward Bernays was considered the most accomplished public relations man of his time. He was the man responsible for devising the successful propaganda campaign that persuaded many American women to start smoking cigarettes way back in the 1920s. In regards to his use of propaganda, I think it is important to point out that in one of his other books called Crystallizing Public Opinion, 1923, he wrote the following: A redefinition of ethics is necessary. The subject matter of the propaganda need not necessarily be true. In regard to the story of water fluoridation, a crystal clear example of disbelief in action is the following. Fluoride is so toxic that it is considered hazardous waste by the EPA. It is more toxic than lead and slightly less toxic than arsenic. Fluoride is a drug that it's not approved by the FDA, which means it has gone through no testing procedures to ensure its safety, benefits, or cost effectiveness. Yet, the promoters of water fluoridation, the U.S. Centers for Disease Control and American Dental Association, have persistently stated that water fluoridation is safe and effective to prevent tooth decay. There is no evidence that these poisons prevent tooth decay, but there is abundant research showing that fluoride is toxic to our body. So before you consume any more of it, wouldn't you like to learn more about the biggest part of the fluoride story? The part that lies beneath the propaganda? I highly recommend that you, your family, and your friends read my book and become aware of your dental choices. Well-educated choices may result in health rather than disease, longevity instead of premature death. May you continue to watch, listen, learn, and be empowered. Join me in waking up our nation in search for health and true freedom. Thanks.